Hello, I'm Dr. Valerie Walker, and welcome to another medical moment. Today we're going to be talking about something that's a little bit sad, but it's something that you got to hear, and you have to hear these type of things so that we can do things about it. Today our show is entitled Post-Traumatic Stress Disorder, and a lot of people suffer it and don't even know that they suffer post-traumatic stress disorder. It's been estimated in the United States every year estimated that 3.6% of Americans will suffer with post-traumatic stress disorder this year. But it is my opinion, it's more than that, because we've all been through stressful times that can really alter our whole life. Let's just go through a few examples and you can see if you fit in any of them, or if you could think of things that happened in your life, especially in your childhood, that could predispose you to post-traumatic stress disorder. Number one, rejection. If you were rejected as a child or didn't feel love, guess what? When you grow up, you're not going to be able to give love and you're not going to be able to receive love, because a lot of times what you do, you sabotage your own relationships. You know why? Because you don't feel worthy. That's one form of post-traumatic stress disorder. Another one is childhood abuse. If you've been abused as a child, and all you people out there who are abusing children, stop it. It's not a good thing, because children grow up that has been abused with all kind of problems, especially sexual abuse, mental abuse. If you holler at your child all the time, sometimes they get in relationships with a person holler, they retreat and start having anxiety, and also a lot that happens in a person's childhood has a lot to do with them developing post-traumatic stress disorder in the future. Another one we want to talk about is the military. In the old days, you used to talk about the Vietnam vets, and we always used to say, oh, that was a useless war, we should have never been over there and all. And when the veterans came back, we would say, oh, they were just baby killers and they should not have been there in the first place. Well, first of all, it was a war and they had to go at the direction of the United States. And then you say they cell shot, and I want to say, like Dr. Phil would probably say, stop saying that. That is not funny. That's not a term that you use for someone who actually laid their life down to try to go and defend this company. And veterans, and we're going to talk about that a little later, they had a lot of problems with being shell shot, or sometimes like the 4th of July when all the fireworks are going off and everybody's having fun. Guess what? They can't even stand to hear all those noises. Sometimes if a car just backfires, boom, they can jump and just get nervous, because the problem with patients who have post-traumatic stress disorder is their body is tuned into that fight or flight response. And we're going to talk about that in some of the future shows. But the body is equipped, like say if a big old bear rushed in here right now to eat me, it's time for me to take flight. So all these different hormones will come out to help me to do this. Well, research has shown that suffer with post-traumatic stress disorder, they have an unusual amount of that fight or flight response in them. And that's why if somebody hear a startling noise that suffer with post-traumatic stress disorder, it'll make them jump real fast. Where you could be sitting there being real cool, they would jump. So that's a problem that we have. In one particular case I can remember in particular, a post-traumatic stress disorder, is, have any of y'all ever been trapped in an elevator? That is an eerie feeling. I've been trapped only once, and it's not a pleasant feeling. And I remember when I got trapped, a lady in there said, oh, I'm about to throw up. I'm about to have a panic attack. I said, ma'am, please, I'm a doctor. I'll take care of you if something happens. But please don't throw up in this elevator and have a panic attack, because we don't know how long we're going to be stuck in this elevator. And it was so funny when they finally got us between 2 floors and the door opened a little bit. I said, I don't know about you all, but I'm climbing out of this elevator. In rushes the security guard, stay where you are, stay where you are. You can't get out of this elevator. I climbed right out, because the elevator may drop. I said, I'm taking my chances that this elevator gonna drop, because I am getting off this elevator and help the other people get off too. And then I went on back to was at the hospital seeing my patients. So if you've ever been in a situation like that, and actually one of the ladies who was trapped on the elevator developed a full-blown asthmatic attack. Never had asthma in her life, and then to this day is still being treated for asthma. So things that can terrify you or hurt you, they can also hurt the human body. So what is post-traumatic stress disorder? What you need to know, number one, is that it is a mental disorder. And because it's a mental disorder, and we know that mind is a big computer chip, it controls the human body, it can advance itself onto physical things too. Meaning your physical health can start going down if your mental health is going down. So it is a mental disorder, and it comes in a lot of phases too. And it happens when either you experience something or witness something that is so terrifying to you that it just stays with you. It does not go nowhere. And you could not ever even experience it or witness it. Maybe you know something, or somebody told you some deep, dark secret that is so horrible. It always is a horrible event. That's why we call it post-traumatic disorder. After you hear this, that it can start you to having nightmares and difficulty sleeping and insomnia. And we see that throughout newspapers today. It's so horrible to look at the news. They even got a news channel out that says nice news. I said that would be good, because we need some nice news at this point. So just remember, it's either if you experience something really bad or it happened to you. And it's something that you can't forget, and you start having these things we call flashbacks. And what a flashback is you relive that thing that happened to you over and over and over and over in your mind. That's what we call flashbacks. And they are very painful, and they are very difficult, and it makes it hard for you to just carry on a lot of times. Just your day-to-day activity, just things you need to do just to get through the day, is hard to carry on if you keep having flashbacks of things that has happened to you in the past. Some of the other things you need to remember, you can have nightmares, or what we call night terrors, where you can wake up in a cold sweat and you wake up remembering those things that happened to you, whatever that trauma was. And later on, when we talk about treatment and talking to a counselor, one of the treatments is you're going to have to address it. You're going to have to talk about it. You're going to have to stop avoiding it, because avoiding it does not help. I think Joyce Meyer, one of the greatest televangelists that we have today, often talks about being abused at the hands of her father. But if you can see, Joyce Meyer has moved on, and she's gone on, and that's one of the treatments that we do with post-traumatic stress disorder. We give you ways through a thing called cognitive behavioral therapy to try to get you past this, to know that life goes on even when the trauma goes on. So when she talks about this, she's only trying to show you that even though this was horrific, it was horrible, it was terrible, it was heinous, but she got through it. And that's why everybody loves her ministry. She's like a pillar of hope to all us out here. So we can take a lesson from Joyce Meyer and the abuse that she suffered. Now, everybody's abuse is different, and it varies. You know, some people that was way on the high end of being abused by your dad sexually. But then we can just have regular little things that we don't even know that we're being traumatized by, but we are. Suppose you got a parent that just holler at you all the time. Just holler, just holler, just holler, just for no reason. They always holler. And guess what? That can sink into you so that you could get a very good high-paying job, and the moment the boss come in and holler at you because you did something wrong, guess what? You'll start reliving all those times in your childhood when you got hollered at, and it's trauma for you, and you be about ready to leave the job. So we've got to address those type of things. There are actually now 4 types of post-traumatic stress disorder, and the first type is intrusive memories. And what that means is that you keep remembering this stuff over and over and over in your mind. You keep getting recurrent thoughts of it. You could be sitting up at a party somewhere having fun, and then all of a sudden them little thoughts start creeping back in your mind, So that's one thing. The other thing with post-traumatic stress disorder is avoidance. We avoid things a lot. Like I had one patient one time witnessed his mother, this is tragic, being murdered. And what happened was he was sitting on the stairs, and there was an abusive relationship with the parents. And this was years and years and years, many years ago. And right to this day, and he witnessed his dad killing his mother, and he was sitting on the stairs, and you know how the stairs, you could see through the little sticks on the stairs. He was just peeping through the stairs, and he witnessed the whole thing. But to this day, he can't stand to be around stairs. But guess what? Stairs are everywhere. Stairs in your home, stairs in malls and office buildings and things. And he always used to say, I just get so panicky when I get around stairs, because all I can remember as a child looking through these stairs and watching my dad shoot my mother and kill her. So that can be a very severe form of post-traumatic stress disorder that really needs fixing. That's called avoidance. The other thing is you have negative changes in your thinking and in your mind. And what happens with those negative changes, you don't see the world right. The world is not a good, gracious place to be in. You doubt yourself. You doubt people. Have you ever seen people that I don't care what you do for them, they're not happy? I call it doom and gloom. I don't care what you say. Maybe I was going to make a joke and say maybe the lottery would change it, but I don't know. But there are always those negative people, and that may be because they suffer with some form of post-traumatic stress disorder. And I got to keep reiterating it to you over and over now. It comes in various forms. Some is severe, some not as severe, but I think if we all look back on our life, we can find a place where we've had some post-traumatic injuries. I can recall my dad died when I was 11. And because he was up to be bishop of the AME church the year he died, the funeral was long. It was long, because, you know, in our church, every pastor from all over the nation had to come and speak at his funeral. Plus, he was a high-ranking officer in the military, and so they had the jets flying overhead and playing the taps and all this. And I think that has a lot to do with why I want to be a doctor, because I said to myself, nobody should have, and the funeral was over 4 hours long, so I'm sitting 4 hours looking at my dad's coffin, which was about 4 feet in front of me, and I wanted to be a doctor at that point because I thought nobody should have to go through this. I've got to be a doctor to stop a lot of all the pain and the suffering that we see in the world, and that's why I chose health care. So that's the other thing, the negative changes in your thought. And then you get changes in your physical and emotional bodies and stuff, because like I said, you always keep this fight or flight hormone rolling in your body, and the fight or flight hormone was put there for a reason, but you can't just be constantly in fight or flight motion, meaning if you've been in combat and you hear a loud noise and you jump and you get very fearful, all that means is that fight or flight concept is just not going right in the body, not responding at the right time. And it varies over time, and it varies from person to person. Some people have post-traumatic stress disorder, some type of bad thing that happened to them, and they can go on, like I said, like Evangelist Joyce Meyer, and deal with it. And one of the best ways you deal with it is what she's doing, is you talk about it. And a lot of people avoid it. They avoid the situation, like my patient who can't do stairs anymore. You know, they avoid talking about it. They don't want to talk about it because a lot of times we think if we don't talk about something, it's going to go away. But guess what? No, it's not. All it's going to do is over time, it's going to get worse and worse and worse. So you're going to have to address it. One way or the other, you've got to address it. And then the other thing we're going to talk about, let's get to our little notes here, is the avoidance. And we talked about how you're going to avoid the places, activities, and then the negative changes in your thinking and your mood. That is just not good at all. You feel hopeless about the future. If you tell somebody something nice like, oh, it's such a beautiful day today, guess what they're going to hit you back with? Oh, but the weatherman said it's going to storm tomorrow. Well, we're not even talking about tomorrow. We're talking about today. Today is going to be a beautiful day, and you jumped all the way into tomorrow. God only gives you manna for one day. So why can't we just enjoy this one day? In other words, they just got this kind of negative being about them all the time. And that's because they probably been abused most of their life. Difficulty maintaining good relationships. Sometimes you can have a good guy, and guess what you do? You run him off, and then you run him off for that bad boy, and then the bad boy run you off. So that's the way it goes. Like bad boy, what you gonna do when they come for you? Because we don't feel love, and if you don't feel love, you can't give love. So even when you're in a relationship with a person really cares about you, you can run them off too. And there again, that's when you always want to seek some help and talk to your doctor, because it may be something that you have not identified that's making you act the way you're acting. And you also have difficulty experiencing positive emotions. That's that person that you say, oh, it's such a great day. And you said, what's so great about it? Like my mother used to say, we get up and complain all the time. We go, oh, it's raining outside. It's such a bad day. Or we say, oh, it's snowing outside. I don't want to snow. Get out in the snow. It's such a bad day. Or if it's hot, we complain about that. Oh, it's 100 degrees out there. It's such a bad day. Guess what my mother told me? Try missing one of them. Okay? Just try missing one of those quote unquote bad days. Okay. We don't concentrate, and a lot of times we are emotionally numb. Like a lot of times things can happen and all, and you just don't feel anything, and that can be another sign of post-traumatic stress disorder. Now, changes in the physical and emotional reactions in your arousal symptoms. You're easily scared. Like the least little thing can make you scared and go into panic mode. You're always on guard against danger. You're always thinking, peeping out the window, peeping out the door, somebody's out to get you. That happens a lot in drug abuse too, especially in cocaine abuse, but that's not what we're talking about today. We're talking about plain old post-traumatic stress disorder. That's a whole nother show. Then you do self-destructive behavior. A lot of times to deal with your problem, you know what you do. You drink too much. Or you turn to drugs, like that's going to make it go away. But guess what? All it does is make everything worse. It just affords you a new brand of misery. It's the only thing alcohol and drugs can do. They do not take the problem away. You've got to get some counseling. And like I said, we're going to talk about that a little bit in treatment. You have trouble sleeping at night. You toss and you turn. You know why? Because your mind don't ever shut down. You're always reliving over and over and over and over the things that have happened to you, and your brains don't cut off. So you just laying there wondering why you can't go to sleep. Well, you go to sleep when that brain turns off and put you to sleep. But if your mind racing and you thinking about things that happened in the past, or worried about the future and all the bad things that happened to you in your past, because that's why we call it post-traumatic, meaning the event has already happened. It's how you going to deal with that event that's going to make things change. Sometimes you have aggressive behavior. You ever seen people get real aggressive, especially a drunk? The worst thing in the world is an aggressive drunk. They can be just as meek and calm, but then all of a sudden they get a few drinks in them and they want to beat up everybody at the party. There's somebody's uncle out there somewhere. They want to beat up somebody at the party. So you can get very aggressive because there again, you're not addressing the post-traumatic stress syndrome or the things that have led you to act the way that you act. And then the other thing, and the last I want to say on that, is sometimes we feel overwhelmed and shame, like it's our fault. Let's say if a child has been molested, it is not your fault. It's no reason why a child should be having sex with an adult. That's just something that's hard to get over and is not a good thing. And those children need a lot of counseling. And don't blame yourself. That's an adult. You are a child and you had nothing to do with the things that they were trying to do to you. So that's the first half. We got to do two halves on this because this is a lot. Post-traumatic stress syndrome, like I said, I think it affects everybody to a certain degree. So this is going to conclude our part one, and then we're going to come right back to you and tell you some of the things to look for in your child if you're thinking that they're maybe suffering from post-traumatic stress disorder, and mainly the treatment. We'll be right back. Hello, I'm Dr. Valerie Walker, and welcome back to part 2 of post-traumatic stress disorder. This is a disorder, it's a mental condition, and like I said earlier in the previous show, mental conditions can lead to physical conditions because it can make us do things that we don't want to do. Like if you're feeling that away, you can overeat, which can lead to high blood pressure, obesity, high cholesterol. We can eat all the wrong things just depending on that mindset. That mind controls, the big computer controls that whole human body. So we've got to get it in check. And when it's going a little astray, the whole human body can go astray also. Now, just to recap just a little of it, then I won't recap much of it, is that post-traumatic stress disorder is a mental disorder, and it's estimated that it affects 3.6% of Americans every year. But like I said before, I think it's much more than that. And it always happens after a traumatic event that either you were a part of, that you experienced it, or you saw it, you witnessed it, or sometimes you didn't experience it or witness it, you just know about it, meaning it was so heinous and you know about it, it can lead to post-traumatic stress disorder. So let's just talk about sometime in children. And we're talking about children 6 years of age and under, and some of the ways we can know, because that's one of the leading causes of post-traumatic stress disorder in adulthood. It's what happened to children in their childhood, and some ways that we can recognize that something is going wrong with your child. And one of the things that we see with children who's been abused, especially sexual abuse, is they reenact the event. And what they do, if you give them like $2 to play with, and you've seen this experiment they do on TV a lot. If you give them a doll to play with, they will mimic what has been done to them, like mimic a sex act with the doll, or let the two dolls kiss. If you get like a bobbing Ken, they will make them kiss. So they really reenacted what has happened with them. And they also can have really bad nightmares and night terrors and all this can signal that something is going wrong. Now, not always true, but just things for parents to just look at. And then when kids start doing sexual things at a really early age, then you got to kind of start paying attention, because years and years ago, I had a friend of mine that told me about her daughter, only 3, was masturbating and just playing with her genitals all day long. Well, usually that's not just right behavior for a 2 or 3-year-old. So those are the things that you want to pay attention to and try to track down and see what's going on, because children, they display their things that are going wrong with them different than in adults. That's why we have a different specialties: family medicine, internal medicine, and pediatrics. The children react different. So just pay attention to your child's behavior and mention them to your doctor if you think that that child is acting sort of peculiar, especially around certain people. Like I said before, the symptoms vary over time, and they're different in everybody, because every degree of post-traumatic stress syndrome is different. Some people have mild stress. Some people have horrendous things, have witnessed multiple people getting shot and killed and all this. So that can be really, really bad. And the symptoms also get worse when you're under stress. You're going to hear throughout this program all the time that we talk about stress, stress, stress. Stress makes everything bad. So even if you suffer with post-traumatic stress disorder, if you get stressed out over something else, guess what? It can make you have flashbacks. Remember, I told you what a flashback was, is you remembering what happened to you. So flashbacks can happen, and then it can make the whole situation just blow out and get much, much worse. If you having thoughts of disturbing thoughts all the time, things just not right, they're never gonna be right, and I'm never gonna be right. Those are things that you always want to mention to your doctor if they're getting severe, and if you having difficulty getting your life back on track. Like, look at it again, I'll use Joyce Meyer. She went through a lot, but she got her life back on track, back to rising up to be one of our great televangelists that gives us all a lot of good advice. So you can get back on track, but the first thing you got to recognize that If you have a problem, then you need to talk to your doctor about it, and then they can help give you the help that you would need. So let's just go over some of the risk factors, and we'll go through these because then we're going to finish it up with what are some of our treatment options that we have. One of the risk factors is childhood abuse. And we've talked about that. So and it carries on. It doesn't stop when the abuse stops or you grown. Children remember childhood abuse forever. So it's still there and it needs to be addressed. If you've been exposed to intense or long-term bad treatment, like we had a person one time, the husband locked in the basement and made them eat dog food for months and months and months. That kind of trauma, once we get to you, is going to need a whole lot of work. Military personnel, first responders, actually people that's responding to COVID and all the stress we're having and all the deaths that we're having, they can be predisposed to post-traumatic stress disorder. Long-standing anxiety and depression. And also, if anxiety and depression run in your family, then you can be predisposed or at risk for post-traumatic stress disorder. Excess drinking and drug use. There again, we've talked about shows. We did show on alcoholism, and I showed you all the difference between beer and wine, etc., etc. But anything, always remember, in excess is a problem. Drinking in excess is a problem. For women, I told you 1 drink a day, and for men, 2. Drugs, they're out, period. Drugs do not do anything but multiply your misery. So drugs is all the way out. If you have a family history of anxiety and depression, we do know that there is a link between anxiety and depression and the family. So you want to always get to know that family history. And stop being so secretive about the family history. When the kids come and ask you, Mom, Dad, what running this family, then tell them. Because they need to know these type of things so that they can protect their own health and that they can pass these things down through generation and break generational curses like Bishop Jake always talk about. You got to break these generation curses. And he loved to say, and get away from that stinking thinking, because that's what most of our thinking is. So we've got to do that also. If you have a lack of a good support system, that sets you up for really severe post-traumatic stress disorder. And some of the kinds of traumatic disorders we see is combat exposure. Soldiers, like I said, who've been to war, like the Vietnam War, and when they came back, they were told that they were baby killers. They did not get the welcoming response that a lot of the wars get. And they coming back not only from a war, over there they threw poisonous snakes on them. Well, I'm from the country. I'm from Georgia, and I'm very familiar with snakes. And trust me, you do not want to be walking and somebody throw a poisonous snake on you. So you, every time then after that, they usually see a snake, that probably just triggers all of this stuff that they experienced in Vietnam. It just brings back what I told you about the flashback. You going back to how it was when it happened. And also sexual violence. You know, sexual trafficking, that's a big thing we see with girls now. That's why I tell teenagers, you may not want your parents to know everywhere you're going, but please let them know. Because we have people that will sling you in the back of these white vans and nobody will never hear from you no more. So keep your trackers on and let them know where you are, because this thing with sex trafficking is real. It hasn't gone anywhere. And I think sometimes the problem is actually getting worse. People come up missing, especially young people, all the time. And when we do find them, you better know they're going to be suffering some from post-traumatic stress disorder. Other thing is, if you've been physically assaulted, you know, if you're in a marriage or an abusive relationship and you're getting beat down by your spouse or your significant other, and ladies, I'm not sparing you all, because guess what? Some of y'all jump on the men too. I've had men beat up by you ladies. Yeah, you're getting ladies, you all are getting real aggressive too. I don't know what's going on, especially these young girls. They're getting very, very aggressive, and that's a whole nother show. And trust me, stick with me. We're going to talk about all of these things. So that could be it. Being threatened with a weapon. You know, I've had patients have had guns put straight to their forehead, about to be pulled. That is, so what happens after that, when patients then see guns and stuff, it just scares the crap out of them because they've had a gun pulled on them, threatening to be robbed, threatening to be killed. All that can lead to post-traumatic, so that's a risk for it. Also, things like fires or natural disasters like the Twin Towers when the planes flew into them, all those things can lead to post-traumatic. Even if you didn't have a family member there, I've had patients scared to fly after that. They would come and say, Dr. Walker, I got a very important meeting out of town, but I'm scared to fly. So all of this can lead to post-traumatic stress disorder. Anything that disrupts your normal flow of thinking, disrupts your life, can lead to post-traumatic stress disorder. But again, help, like I said, is on the way. So let's just talk about the treatment. It could be long-term, it could be short-term, psychotherapy plus medication. What we're trying to do is improve your symptoms, get you better, get so you're not just paralyzed with the fear, or every time something happens, you trigger. Remember I told you about that fight or flight syndrome that's naturally put in the body, but that people with post-traumatic stress disorder, they keep this thing going all the time, and how to quiet those systems down and teach you skills of how to deal with it, how to cope with it, and help, biggest of all, is restore your self-esteem, because patients who've been beat down, sexually abused as a child, even as an adult, been beat up by your spouse or people that's in charge of loving you, it's hard. They have very poor self-esteem. So what we as physicians have to do is try to bring it up. We try to bring it up a notch and get you feeling much better about yourself. One of the therapies we use is called CBT, and that's cognitive behavior therapy, where we try to go in and change that thought process that you got going on and make you address it and make you talk about it and try to get you through it as the best way we can. These programs are usually about 12 weeks, and they can last anywhere from 60 to 90 minutes, but that is a very good way to get you back on track. The other thing actually is group therapy. Sometimes it feels good to hear people who've gone through the same thing you've gone through, because what it shows you is that you're not alone. You're not alone in this thing at all. And families need to get involved, because if you were abused as a child and have not had that, I call it come to Jesus meeting with the family to really talk about what really happened, then healing may be a long way off. So we really got to get it out there. We got to talk about it. We got to acknowledge that it did happen. And then we got to figure out ways, let's move forward. You know, how are we going to turn this thing into something positive and move forward? And then we have medications. Lastly, the only two drugs the FDA has approved for the treatment of post-traumatic stress disorder is Paxil and Zoloft. Those have, now doctors can prescribe what we call off-label, meaning that they think a medicine may be good for you and just not have gone through that labeling, but that's things you have to clear up with your doctor, and you have to talk to your doctor about it. You have neurotransmitters in the brain, and we're concerned with like norepinephrine and serotonin and getting all these things regulated. You heard a doctor always tell you, oh, you just got a hormonal imbalance, but sometimes you really do have a hormonal imbalance. So in conclusion, what we want to say, the biggest risk, though, is the risk of suicide. If this thing is getting too overpowering and too much, you want to talk to a friend, you want to talk to a family member, you want to call an emergency room. If you feel like you want to hurt yourself, you want to help hurt others, that is an emergency. We got a national suicide prevention hotline, and I'm quite sure the producers of this show can put that number up, but it's 1-800-273-TALK. And if you are a veteran, then you need to push the number 1 to be connected to the Veterans Crisis line. And like I said, if you didn't write it down, don't worry, we'll have it up on the screen for you. But always know any thoughts of suicide is an emergency, and call 911. Call a friend. That friend can transport you to the emergency room in a safe way, then let them do that. But that is an emergency, because that is one of the things we do see with long-standing post-traumatic stress syndrome that goes untreated is suicide. So I hope you enjoyed our show for today. We just tried to shed some light on something that's very common, and since COVID, and all these things that have happened in the world. I think most people now are suffering with some post-traumatic stress disorder. So talk to your doctor about it. Talk to your friends about it. Don't keep it to yourself. That is the worst thing that you can do. So this has been our topic. I'm Dr. Valerie Walker, and we'll see you next time on The Medical Moment. I hope you enjoyed the show.